I'm Radhika Sundararajan. I'm delighted to be here today to tell you a little bit about the work that we've been doing with traditional healers. So to give you a little bit of background, I think most people don't think too much about traditional medicine, but I do think about it a lot. So throughout sub-Saharan Africa, traditional or spiritual healers actually play a central role in communities for health-related and spiritual concerns. The World Health Organization estimates that 80% of the general population of sub-Saharan Africa utilize these practitioners. And in Mozambique specifically, they play an even more crucial role in managing health complaints. With independence in 1975, came a massive exodus of Mozambique's physicians, many of whom were under contract with the Portuguese colonial government. So much of the health infrastructure that developed subsequent to independence actually has been decimated by a 15-year-long civil war subsequent to independence. So Mozambique currently faces a dearth of physicians with a population of 3 physicians for every 100,000 people. This is among the lowest proportion of physicians in the whole world, so it's very low. Healthcare facilities, we know, are sparsely distributed around the country. Less than 50% of the population is estimated to have regular access to health services. So patients are expected to travel long distances to access biomedical facilities, and in addition, we couple this problem of access with the context of extreme poverty in most of Mozambique. The WHO recently ranked Mozambique among the poorest 15 countries in the sub-Saharan region. So in considering low socioeconomic status for much of Mozambique, Mozambicans, this really confounds the issue of access to biomedical care, as costs of travel can be quite prohibitive for people receiving care at distant facilities. Last, we know that medication stockouts are a big problem at biomedical clinics, and this really undermines patients' confidence in receiving appropriate treatment at these facilities. So these are some structural issues that we know are in play for people who need biomedical care, and in concert with strong cultural traditions that favor the services of traditional healers, we really find a reliance on these providers for nearly all somatic complaints. So utilization of traditional healers is actually quite relevant to the battle against the HIV epidemic in Mozambique. Recently, Mozambique was estimated to have the 3rd highest rate of AIDS-related deaths in sub-Saharan Africa, behind Nigeria and South Africa. The most recent national survey estimates HIV prevalence among sexually active adults at 10.5%. There are 1.5 million people living with HIV in Mozambique generally. However, in the capital city of Maputo, prevalence is nearly twice the national rate at 19.8%, and 9% of all Mozambicans living with HIV actually reside in Maputo city. The country's long civil war also created a population level skew that is particularly relevant to the HIV epidemic. 51% of the current population is of sexually active age. So despite being the nation's capital, home to one of the country's 3 referral hospitals, one of which we heard a little bit about in the previous presentation, the location of the highest density of biomedical clinics in the country, Maputo's residents actually still utilize traditional healers for the reasons previously summarized, but also importantly suggesting that traditional healer use is not strictly related to access to biomedical care. So that's where Maputo is, in case you didn't know, in the very bottom. So what we did with our study is we sought to characterize the knowledge and the care provided by traditional healers to their clients in the HIV endemic region of Maputo City. In doing so, we employed qualitative data collection methods, so we conducted minimally structured interviews with 31 traditional healers throughout Maputo. This data collection is actually still ongoing, but primarily the data I'm going to talk about today was collected between March and September of 2016. This map shows the distribution of our participants from around the city of Maputo. Roughly half of our participants, 15, were recruited in cooperation with a group called Ametramo. So Ametramo is a national organization that represents traditional healers. They're like a union of traditional healers, and they're recognized by the government. The other half of our participants were recruited through snowball sampling and by asking participants for referral to their colleagues. We also recruited by soliciting referral to traditional healers from around various communities in the city so that we could have somewhat of a equal distribution throughout the city center. So this table summarizes our study participants. You'll notice that nearly 3/4 of our participants were female. Average age was approximately 50 years old. Most had completed some level of formal education. Average client volume, so we asked them, how many clients per week do you generally see? Most saw about 5 clients per week. And weekly income was approximately 2,000 meticais, or $26 US. All participants also completed an HIV knowledge test. At the completion of the interview, we administered the KQ-18 HIV knowledge scale. The average score on this scale was 11 from a possible 18, and you can see the range here varies between 3 and 16. So we did actually find some significant differences in HIV knowledge between different types of healers in our sample. So here you'll see that we noted statistical significance in HIV knowledge between older and younger healers. The age sort of cutoff we used was 40, but you can see that there's a lot more older healers than younger healers in our sample. We also noted a difference between healers with low volume practices and those with higher volume, and we're saying low volume being less than or equal to 4 and high volume being greater than 4 clients per week, and between those earning 1,300 meticais or less per week and those earning more. In this table, we do see that income and volume are obviously related. However, they're not directly related. We actually had a handful of what you could describe as expensive healers who reported having less than 4 clients per week but earning more than 1,300 meticais. So they're making a good living, I guess. Our data suggested that male healers have slightly higher HIV knowledge scores, though statistical significance of this difference is limited by a small number of men in our study, but also reflecting the fact that women are predominantly practicing as traditional healers in sub-Saharan Africa. Next, I want to talk about our qualitative results, focusing specifically on the topic of biomedicine among our participants. So in general, we noted very positive attitudes towards biomedicine expressed in our interviews. Healers describe biomedicine as, quote unquote, very important and effective at addressing the, quote unquote, limitations of traditional medicine by treating, quote, diseases such as TB and HIV and AIDS, which I do not treat, end quote. Healers themselves actually visit the hospital for any illnesses or somatic pain. One healer described his last visit to the hospital for treatment of malaria. Quote, I was well taken care of. I was given medicine that helped me recover. The way the doctors talk, how they ask, how or what I feel makes one confident that you are in good hands. Another stated, the hospital physicians attend to me with passion. They administer pills that really help me. In their practice, healers rely on stones or amulets. You can see here she's wearing some amulets and doing a ritual here. These devices inform their clinical decision-making practices for their clients. The decision to refer a client for testing or treatment at a biomedical facility is attributed to the divining power of these materials, but also shaped by assessment of the patient's physical appearance or symptoms. Participants attended some formalized HIV educational program, either at a hospital, a clinic, or organized through Amatramo, the National Union of Traditional Healers, or the Mozambique Ministry of Health. Despite this, very few of our traditional healer clients provided counseling on HIV risk reduction. They basically never recommended HIV testing for asymptomatic clients. While they did recognize symptoms of AIDS, including what they described as weight loss, diarrhea, skin rashes, and general malaise, none of our healers either claimed to be able to cure or treat HIV/AIDS, which is, I think, in contrast to what our general opinion as biomedical scientists is. None of our healers admitted that, at least. More commonly, healers actually describe their realm of expertise as what they described as, quote unquote, social problems. So they describe treating things as marital discord, family conflict, or, quote unquote, bad luck, which is difficulty gaining or maintaining employment or difficulty conceiving. These issues are treated through a process called kufemba, where the healer performs incantations to remove the evil spirits that are plaguing their clients, or they use herbal baths, tonics for consumption, or a process they call vaccination, where a small amount of herbs are rubbed into a small cut in the skin. Traditional healers in our sample report advocating for their clients. So they often report personally escorting their clients to the hospital. They'll call family members to transport the client to the hospital, or they'll actually contact the hospital, like by placing a referral of sorts, to arrange for their reception. In recognizing their limitations, the healers actually do attempt to escalate to appropriate biomedical care. But patients, on the other hand, often hope for traditional problems, such as bewitching or ancestral curses, to explain the problems that they're having. In addition, less than 34% of Mozambicans have ever received an HIV test in their lifetime. So these low rates of testing make it very unlikely that clients who come to the healers have ever received an HIV test or know their HIV status. Healers who attempt to escalate care sometimes find that patients are unhappy or unwilling to go to the hospital. One healer described his patient's response to being referred. Quote, he was not happy. Most clients do not welcome that. They say it is bad luck when a healer says no to a patient. Some think that since they come with money, they must get consultation and treatment, so they wonder why I send them to the hospital. But I try to make them comprehend why I do so. I even explain it to the relatives that come with the patient. I tell them I'm not throwing them out, and they can return to me after the hospital. Another healer stated, we tell patients to go to the hospital. They say, okay, I will go tomorrow, and then they run away because they do not want to go to the hospital. When the person is not willing to listen, he will just vanish from you. When they come here, sometimes they are avoiding going to the hospital, or they've been there already and were diagnosed with HIV, and they hide it and come back to us. You ask him to go to the hospital, he runs away. In summary, Mozambique is a context of medical pluralism, where biomedical and traditional providers are consulted in sequence or concurrently. Due to structural and cultural factors in this setting, traditional healers are often preferred. This is a preference that could be secondary to fear of stigma from being diagnosed with a disease such as HIV infection, or prohibitive issues that I discussed earlier that are associated with biomedical facility visits, such as high transportation costs, or due to a general lack of trust in biomedicine, which we know exists in a lot of low resource settings. While healers recognize common symptoms of AIDS, our participants did not actually routinely discuss strategies for HIV prevention and risk reduction, including routine testing, condom use, abstinence, male circumcision, and harm reduction for those using injection drugs. Further, in this endemic region, healers do not refer patients for HIV testing unless they display symptoms consistent with AIDS. Successes of global initiatives to end the HIV epidemic, such as treatment as prevention and universal test and treat, are founded on early identification and treatment of HIV-infected persons, the first step of which is expanding HIV testing among at-risk populations. Our results suggest that implementation of these approaches in a place like Maputo really do face quite significant barriers, where we see that lifetime HIV testing rates are less than 40%, while prevalence is approximately 20%. With involvement and cooperation of traditional healer communities, we may be able to achieve successful expansion of HIV testing programs. In addition, we note higher scores on HIV knowledge scales among those practitioners with high volume, high income, and younger practitioners. This demographic information can be used to guide future educational initiatives focused on improving HIV-related knowledge among traditional healers. By the way, this is the president of Amatramo, the National Healer Union, and this is her apprentice, and this is sort of a typical, actually this is like a really nice traditional healer clinic per se. This is probably like, I mean, it's the president's quarters, so it's like the nicest that you're going to see, but it is very, very nice. So in conclusion, our study indicates that Mozambican traditional healers have had generally positive experiences with biomedicine, and in their own practices acted appropriately by referring patients to the hospital who they suspected of having serious underlying medical issues. The majority of participants have basic understanding of HIV symptoms, transmission, and prevention, but do not routinely provide counseling or recommendations that would serve to reduce transmission risks among their clients. We posit that healers would welcome closer working relationships with biomedical providers to improve care and continuity for their clients. While initiatives to end the HIV epidemic struggle to adequately expand HIV testing in high-risk communities, traditional healers are already seeing patients who could benefit from voluntary testing. So we note a gap between patients presenting at traditional healer practices and undergoing testing at biomedical facilities. Bridging this gap is the only way to effectively achieve an AIDS-free generation and improve the health and welfare of Mozambicans. Thank you very much.
Thank you, Radhika, for this nice presentation and keeping on time. Can we take some of the...
Hi, I'm Susanna Graves, and I work at UCSD in the AVRC. And I was wondering if you could tell me a little bit more about who was conducting these interviews. Were they conducted in Portuguese or local language?
Sure. We hired, you can see we have our 3 research assistants here. These are all students at the university who were trained in social sciences, so most of them have masters in sociology. My collaborators at UEM are actually both, Dr. Manuel's an anthropologist and Dr. Langa's a sociologist. I trained all of the research assistants myself. We had an interview guide. They were minimally structured interviews. We would actually ask every participant which language they preferred. Every research assistant was fluent in both Portuguese and Xangana. So Xangana is the local language that is, I would say, 80% of the interviews were conducted in Xangana.
Hi, I'm Bonnie Tran, and I'm an epidemiologist from the Department of Defense HIV/AIDS Prevention Program. Very nice presentation. How common is male circumcision in Mozambique, and do any of the traditional healers practice traditional male circumcision?
That is a great question that I feel unqualified to answer. I don't actually know the male circumcision rates in Mozambique. I do know that the traditional healers do not consider that within their scope of practice. There are some practitioners that are specifically what they're called birth attendants, and they are actually preferred instead of in hospital deliveries. So that's another kind of problem that I think people face, is that as part of linking HIV-infected mothers to care and making sure that you reduce transmission to the unborn child, they really emphasize prenatal care and deliveries in hospitals. However, in Mozambique, as many countries in sub-Saharan Africa, people really prefer traditional healer deliveries because of cultural preferences, ideas about luck and where babies are supposed to be born, etc. I do not know of any healers that actually performed male circumcision, and as I mentioned, they don't really even know about it. I think we had a couple of healers that mentioned that it was a thing you could do to reduce HIV transmission, but it's not a generally, it's not a widely considered practice. But if anyone, which I'm sure in this room of experts, may know the rate of male circumcision, and perhaps Dr. Amelia knows. I actually don't know if it's widely uptaken or not.
Thank you very much. Please, we'll take 2 more. And
Hi, my name is Marissa. So I really thought that was super interesting, especially how there's the discord between healers who are affirming the validity of the biomedical approaches while the public expresses this lack of trust. So I was just wondering if you feel there's an efficient way of creating an interdisciplinary approach so that the biomedical providers can work with the traditional healers, maybe in male circumcision or additional ways.
That's an excellent question. So we're talking about sort of creating some sort of interdisciplinary approach to bridging that gap, I guess, that I discussed. There's a group actually at Vanderbilt that works in northern Mozambique who's been working with birth attendants to try and do that. I think for the population that I work with, what I find so interesting about Maputo in general is that there really are lots of biomedical clinics available. I mean, whether they're stocked and whether people can be seen in a timely manner is a different problem. But I do think that we as biomedical providers really need to understand and be more informed about what traditional healers are doing, particularly because they are seeing these patients early and often. And so my vision for the future is to try and bridge that gap, whether it's by forming some sort of a community board where you have healers and biomedical providers talking to each other about what's the best thing to do. I mean, obviously, we all want the same thing. We want to make our patients better, help them get better faster, and link them to care and make them healthy. But I do think that the first step is talking to each other, and I do think actually Mozambique is somewhat fortunate because they have this group called Amatramo, whereas other countries, I think you have many more factions of traditional healers. Theoretically, there's a very large entity that the government approves of. While not every healer is a part of it, they claim to be, very, very sort of coherent and powerful. So theoretically, you could, if you got them on board, that might be a first step.
Thank you, Radhika. We'll take two more, please. Go
Hi,
ahead.
I'm Alan McCutcheon. I'm a retired clinician. I wondered if you ask them about their interest in being trained for counseling or perhaps even rapid testing or something like that in your interviews. And a second quick question. I noticed that 2/3 of your respondents were women. Does that reflect the population of healers, or were women just more cooperative and willing to join?
Great question. So we specifically did not ask about their interest in learning things such as point-of-care testing, although that is an interest of mine that I'm hoping to move forward with in my own research. I think in many ways this research, however, sets the stage for introducing that possibility, demonstrating that there is quite favorable attitudes towards biomedicine and that people were very, very interested in learning more and being more involved with the care of their patients. And secondly, your question was about the proportion of women. In general, in Mozambique and throughout sub-Saharan Africa, it's primarily women who are doing this, practicing as traditional healers. So I do think that proportion is a fairly accurate reflection. I think we may have had one or two people who did not want to participate, but in general, people were very willing to speak with us, mostly because we wanted to just ask them what they did, and everybody, I think, wants to talk about themselves at some level.
Thank you. One more, please. I thought we have more people. Oh, okay, and then we close our discussion.
Hi, my name is Shilpi and I work at UCSD. I just wanted to ask, what are the measures do you take to educate the people so that they can prevent themselves from infected with HIV at the first place itself?
Can you ask the first part of your question again?
What are the measures do you take to educate these people around so that they can prevent themselves from getting infected with the HIV?
You're talking about the practitioners, the traditional healers?
Yeah, or in general too.
Okay. They have very good understanding about bloodborne transmission and use barrier protection, reducing the number of sexual partners, etc. I think most of them will say things like, I know I can get HIV from my clients because when I use a razor, I could get their blood on me. So they kind of understand that very, I think, very basic transmission theory. I think it would be worth talking specifically about things like, do you really use a new razor on every client that you do vaccinations on? Because they will tell you that they do that, but when you go to their practices, you'll find sort of like razors sitting around in piles of herbs. So it makes me think maybe they're not actually doing that. They're supposed to use gloves. I don't think that even hospitals have gloves for everybody to use, new gloves, right? So are traditional healers really using new gloves every time they use a razor and cut? Because they literally rub the herbs into this cut with their fingers. So I think there are some things we could be doing to specifically reduce their occupational risks. But things like male circumcision, things like harm reduction, for injection drug use, these are not, we don't really, that kind of second level of prevention is not really well understood among this population, and I suspect among sort of Mozambicans in general. So I think we really need to focus, especially with our educational initiatives, because they all know, they watch TV and they listen to the radio, but they also go to these training sessions. So I think these are things we could kind of escalate.